Hello, family members and ombudsman and people just curious about finding out more when trying to get better care for your loved one in residence in long-term care homes. I'm Janine Ferrari. I'm the Family Council Liaison with the Long-Term Care Community Coalition. Today, I am excited to be talking to Richard Mollett, who's the Executive Director of the Long-Term Care Community Coalition and all-around guru. For what to do and what to know when your family members live in a long-term care residence throughout the United States. And we are being simulcast live on Facebook as we speak. So welcome on this beautiful summer day. We'll be putting links in the chat. We will be also answering some questions that were sent in when you registered. But feel free to put your questions in the chat and raise your hand. We'll be taking some live questions.
Looks like we still have some people joining, so maybe just 30 more seconds or so till we get started.
Thanks for everyone's patience. Thank you. Thanks for everyone's patience. Hello, Bruno. Bon appetit.
It just made me hungry.
Yes. We're letting in a few more people, and then we will begin. Okay. Welcome, everyone. As I mentioned before, we have Richard Mollett, who's the Executive Director with Long-Term Care Community Coalition. And we will be talking today about how to, I guess, escalate problems if you're not being heard or listened to, if your emails aren't being answered, what your next choices are and what your next steps should be when dealing with your long-term care residence administrator and staff. And today we'll be talking to Richard. So Richard, I'm excited and nervous to talk to you about this.
Oh, no, not at all. So hi, thanks so much. I'm going to share my screen. Hopefully, can you see that?
Yes.
Great, thanks so much. So as Janine said, what I'm going to do is kind of give a little bit lay of the land and some perspectives on what to do when you have an issue in a nursing home and the issue is not being addressed in an appropriate way. And thanks, nice to see a lot of familiar faces today. Hi, Jed, always good to see you. So I will get started. This is, I think, really the baseline. These are the fundamentals. And again, we'll share this, we'll share the slide deck as as a PDF. So you're welcome to use them. Maybe we can even post it on the webpage if it makes sense. But the fundamentals to me are to be as knowledgeable as you possibly can, both about what your residents' needs are and what their rights are. And I think that is kind of challenging. It's frankly hard for me to even say that because it shouldn't be up to residents, it shouldn't be up to their families to have to be experts about their care. The reason why we go to a professional nursing home or to go to any professional is because we expect them to be the experts and we hope that we can trust them. But unfortunately, the reason why we have our organization, the reason why families get involved with their resident care, the reason why we have long-term care ombudsman is because far, far too often nursing home care does not fulfill the promises that are made to residents and their families. So it is helpful to be knowledgeable, and again, about both, what the residents' needs are and what their rights are. I'll talk a little bit about that further. I would say number two is to be respectful It's always best, it's always easiest, I think, to get something done if you're respectful. I know it can be hard because by the time there's an issue or when an issue occurs, it can be very upsetting. Um, but it's always helpful to kind of try to take a step back and try to think about what you want to have happen and how can you accomplish that. Next is working close, and we'll talk a lot about this, starting work from the people closest to the resident and moving out from there. Don't go to the very top. It's not really helpful. It's not really generally constructive, and it cuts off a lot of opportunities to hopefully address a problem or an issue earlier on along the way. I would say next is to be clear and concise, and we'll talk about that as well. But it's, in my experience, and I've been a family member a number of times too, you are upset, you're concerned that something bad has happened or is happening to your loved one, and that can make it very hard to be really organized about these things. And we have some tips and tools for that. But I think just to keep in mind is to be as clear and concise again about what your needs are, what your residents' needs are, and what you want changed. And as part of that is tracking your issues, tracking your complaints, tracking your responses. It doesn't have to be anything fancy. It could be a piece of paper. We have a tracking tool that I'll talk about in a little bit. But I think that's really important. I noticed, over the years when I was doing some work with family councils, we had funding for a project several years ago that I worked with family councils in 2 nursing homes every single month for a 1.5-year period. And I would talk about residents' rights, and people would come up to me afterwards and they say, well, my mother has had this problem for so many months, and I talked to the nurses and they said it was going to change, but the change didn't last, etc. And I would say to them, that is a valid concern and a valid complaint. However, if you don't have any way of identifying, or if you haven't identified when the issue happened, what the facility said or what the staff person you spoke to said was going to happen in response, if you don't have that, even a simple record of that, it makes it much harder to substantiate that if the issue remains unresolved, and you take that to the administrator or you take that up to a complaint with the State Department of Health. And then lastly, if at all possible, don't go it alone. Contact your local long-term care ombudsman program. Join with have the resident, if they're able to and interested, join with the resident council. Of course, we're all here today because we think that family councils are really important. I know, again, from personal experience, from having family members in nursing homes, that it can feel burdensome. It can feel like one additional thing when you're already feeling overwhelmed by what's going on. But it actually can be both a relief in terms of having opportunities to share what is going on, but also powerful and making your advocacy easier because you're working together with others. And then lastly, it's not listed here, but it really also brings in a big issue. A lot of people have a fear of retaliation. They don't want to rock the boat. They're afraid that their resident is vulnerable and will be retaliated against. If you are working through your family council, then that is a big, that's a really important way to obviate concerns about retaliation, because you're working as a group, you're not working as an individual. So I'm going to provide just a little background. I'm going to try to do this, wrap up in about 20 minutes, so we have plenty of time to talk. But I wanted to give people just a background about the nursing requirements and residents' rights, because that really gets to the first point that I made in the last slide. Is what are your rights? It's very hard to know. So just as some background, virtually every nursing home in the country is what's called participates in Medicaid and or Medicare. And the vast majority participate in both. And that is government speak for saying that they take Medicaid money and or they take Medicare money. In order to do that, the nursing home agrees to meet all of the standards provided for in what's called the Federal Nursing Home Reform Law, a law that passed in 1987. Now, states can have additional protections, but they can't have any less protection. So really the heart of what protects nursing homes, the standards of care, et cetera, are in the Nursing Home Reform Law and in the requirements that came out of that. Importantly, as I know here in the second to last bullet in orange, these protections, these standards are for every single resident in the facility, no matter who pays for their care. So often I hear about, oh, my resident has gone on to Medicaid, they're not going to get therapy services anymore. No, all the residents in the facility are entitled to the same level of care, and that care is what they need to attain and maintain their highest practicable physical, emotional, and psychosocial well-being. And just very briefly, the federal agency, the Centers for Medicare and Medicaid Services, they pay nursing homes, and they also contract with the State Department of Health to ensure that residents are protected and receive the services that they need and deserve. And importantly, the State Department of Health's responsibility and CMS's responsibility are 24 hours a day, 7 days a week, 365 days of the year. The surveyors, the inspectors may only come in once a year, sometimes even less lately, unfortunately. They may not be great at responding to complaints, but this is the heart of their responsibility to ensure that residents are safe and have access to those rights under the nursing home reform law. So as I mentioned before, at the start, of course, too many nursing homes failed to meet these basic standards. And because of that, too many residents suffer neglect and abuse and demeaning conditions. So I think the purpose of today's program, as I mentioned a couple of times now, is that we want to raise awareness of how nursing homes can and should be held accountable, and in particular for individuals, for families and those working with families, how they can be effective advocates for those that they love. And then the last bullet here I think is really important. I know that these are really significant challenges, and it's really can be very challenging to get a nursing home to move. And the families that I used to speak to when I did that project, and I've done many programs with family councils since then, sometimes people come up and say, well, the resident rights you talked about are great, but this is not what my loved one is experiencing. It's nothing like what my loved one is experiencing. And I know that can be very frustrating and painful. However, in order for us to be able to advocate for our rights in any way, we first have to know what those rights are. And that's why it's so important to know what the residents' rights are. So moving on to, what do we do? As Janine said, what can we do when we have a problem? So as I mentioned at the start, number one is know your residents' rights. Too often, as I know here in purple, we accept substandard care because we've been conditioned to accept it. So what we've done over the years, we put together a guide to residents' rights, and we also have developed from that guide many user-friendly fact sheets, and I've listed just a few of them here regarding abuse, neglect, regarding the use of antipsychotic drugs, bed rails, which I know is a big issue, falls is a big issue. We have a number of fact sheets on dementia care. In fact, we have a whole dementia care advocacy toolkit, which is really where we got started with putting together these materials for residents and families. We have fact sheets on infection control, services. What are the requirements for nursing home care staff? What are the requirements for the administration of a nursing home and for medical care oversight by a physician, for rehabilitation services, for dental services, etc. So, and as you can see on the left, this is just a picture of our learning center. Everything on our website is free to use and share. We have a number of materials up now in Spanish, and we're increasing that. And we're in the process of putting together, particularly some of our family empowerment materials in other languages, including Korean, Chinese, and Creole, in addition to Spanish and English. So those will be coming soon over the summer. We're just reviewing them now and getting them ready for publication. So let's start off. A problem has been identified. You see that something is wrong. The first thing is to consider the severity of that problem and how it can be rectified. So if it's a minor issue, seek help from the floor. See, is there a nurse passing by? Does someone answer? Can you, ring the call bell? Hopefully, someone will answer it. I know that's a big issue. Don't get me wrong with call bell. With call bells not being answered in a quickly in an appropriate time frame in many nursing homes. But this is really where we start off. Okay, there's an issue. Mom's food is cold. Dad needs to go to the bathroom, and he needs some help walking to the bathroom. So ask someone who's nearby. And then if it's a more urgent care or comfort issue, then seek further assistance. Make sure that you get the help that you need. Go down to the nurse's station if necessary. Go to the supervisory staff and go to the administrative staff, again, for an urgent issue. And then lastly, as I note here in orange, if it's a case of a medical or other emergency, dial 911. And I added here, actually, gave this some thought. I added a link to Consumer Reports, has some good tips on what to do in case of emergency. And the reason why I add that here is because it's nursing homes are a medical facility, and they're supposed to, they have to have a licensed nursing, they have to have certified nurses and be overseen by a physician, etc. However, if you are running into serious problems, those things may not be taking place. And we've seen that, unfortunately. I've seen, hidden video camera of nurses walking by a resident who has fallen and who is in distress or has been pushed, or resident who's been in pain. So there could be a serious issue that occurs. And so dial 911. But the reason why I include the tips here, the link to the tips, is because it could be a serious issue and you may not even be getting the appropriate help that you need from the staff. So this can be, frankly, a real lifesaver, just to have a link and some information about what to do in case of emergency if the facility staff are not doing anything. So next, I want to talk about, so questions unanswered, problems unsolved or unresolved. As I mentioned, it's best to start off with those who are working closest to the resident, their direct care staff. However, if that's not working out, for instance, mom has repeatedly cold food and the food is unpalatable, or the food's not appropriate for her. My sister-in-law has diabetes and she's in a nursing home. They constantly give her the wrong food that she cannot eat. And so you see that this is having an impact on the individual. Maybe she's losing weight. Maybe she seems listless. She's just not eating. Example number 2, again, going back to dad who needs help going to the bathroom. This situation keeps reoccurring. So maybe someone helped him, but now they want to put him in a diaper because what they say is there's just not enough staff to take him to the bathroom. You come in, you find that he's sitting in a wet diaper. He doesn't know for how long. He doesn't know the last time someone came and helped him. What do you do? This is really kind of the heart of what we're talking about. It's great if you can get a situation resolved right off the bat, working with the staff on the floor, but far too often that doesn't happen. So what do you do? So here are some things that you can do. Number 1 is contact your long-term care ombudsman program for help. We have links and information on our website. Every nursing home that I've ever been in has posters, usually in English and in Spanish, on the contact information for the long-term care ombudsman program. It has to be provided by the facility as part of your welcome package, etc. Or you could just look it up online. Just look up LTC Ombudsman, and you could do for your county or for your state, and you will get connected. The long-term care ombudsman program is required in every single state under the Older Americans Act, and the ombudsman programs work with residents and their families to resolve issues. Some ombudsman programs, frankly, are stronger than others. Some individuals, of course, just as with any position, can be more helpful than others, but it's really overall the best resource for getting help. It will also help you confidentially. So if you don't want to say what your name is, if you don't want your name used, etc., they can find ways to work around that. As I mentioned before, connect with the family council. It can seem like, oh, that's going to be another thing I need to do, but actually everyone that I can think of who's done it has really found that it's helpful both in supporting emotionally what they're going through, but also supporting substantively, helping them to get the resolution that they need to their issues. So if your nursing home has one, join it. If it doesn't have one, start one. And we have a lot of good tools for that. And then amp up your concerns within the facility. Raise your concerns with the appropriate department. Could be the dietitian, could be therapy or social work staff, or even go to the medical director or the administration for things that are more significant, are more persistent, etc. And then, as I mentioned a couple of times, if at all possible, track your concerns. Too often, as I mentioned again earlier, residents and their families have really valid concerns, but they haven't kept track of them. So people come up to me and they say, I've been having this issue for months. I talked to the nurse on the floor. She said it'd be resolved. It lasted for about a week, and then we were back to the same old, problems again. So that's why it's really useful to track. We put together a pretty simple form. You could see here, it's available on our website, just noting the date when the issue occurred, what the issue was, who was involved, were they witnesses, anyone who saw it, the staff person you spoke to, the response, the action plan that you got from the staff, and then what actually happened. And you could, we have, this essentially, can be, printed out and replicated, and you can just track a particular issue. And then if you have to elevate that issue, either within the nursing home or beyond, you will have some really strong evidence to back up what your concerns are. So one of the things that you can do, in addition to filing making an oral complaint within the facility, is that you can file a grievance. And this is something relatively new. It's about oh goodness, well now it's about 8 years old, I think, that they've had a requirement that facilities have a grievance officer. But this was part of the federal rules that were changed to address the longstanding issues that we've been talking about, and which many of us are too familiar with. You make a complaint to staff, the staff say they'll do something about it, and then either it's only nothing happens, or it's only a short-term solution, and the problem happens again. And then the individual, the family member, the onus is on them to chase people around and say, okay, now I have to find the administrative person. Now I'm being sent to the social worker. Then social worker's not in, and the social worker is telling me I need to speak to somebody else. So every facility under the federal rules has to have an assigned grievance officer who takes in the grievances, who will keep the resident confidence if they wish to, and then it's up to that grievance officer to take it to the appropriate place, whether it be social work, administrative staff, nursing oversight, etc., within the facility, and to come back with you with the response. Now, the grievance, the grievance has to be resolved, but I want to be very careful about that. What that means is that they either have to do what you're asking them to do to resolve the grievance, or if they're not going to do that, they have to say why they are not going to do it. They have to tell you why they are unable to respond to your grievance. And they may have a legitimate reason. It may impose on someone else's rights, etc. And importantly, you have the right to get this decision in writing from the nursing home. So that's really important, again, because things in writing help you substantiate and support your advocacy, both in the nursing home and beyond. So a couple of other tips that we have in terms of, and these are based upon our fact sheets, as you can see here, is to request a resident assessment and or a care planning meeting. And this is one of our fact sheets. Virtually all of our fact sheets, except for one or two, are just 2 pages long, as you see here. So they're easy to print out. You can put them in your pocket or in your pocketbook, etc. You can bring them to a nursing home. And what I always tell people is a lesson I learned myself from a nursing home resident a few years ago, is to use the information in the fact sheet in a positive way with staff. Say, these are my rights. How can you help me achieve them? So these fact sheets can be useful all along the way. I'm talking about resident assessment and care planning here because that just kind of these are some of the biggest issues that residents face, and it really ties in with everything. It ties in with falls, with antipsychotic drugging, with good dementia care, with food, with appropriate activities, etc. Why? Because essentially this is kind of what I like to call like a 1-2 punch when it comes to accessing good nursing home care. On the left-hand side, you could see the resident assessment, and the federal requirements for the resident assessment say that it must include at least the following: the residents' demographic information, their customary routine, their cognitive patterns, their ability to communicate, their mood and behavioral patterns, their vision, their psychosocial well-being, their physical functioning, their continence, dental and nutritional status, skin condition, their interest in activities, et cetera, et cetera. And you could use that checklist to identify what's important to you when you have a resident assessment. And that assessment is really important because that assessment is what the care plan is based on. And the care plan spells out what the nursing home is going to do. So to quickly go back to the example of the individual, the father who had trouble with continence because he needed help going to the bathroom and he wasn't getting it. Continence is listed here. And you could say, as part of the resident assessment, that this is something your father is continent, but he needs help to go to the bathroom. And therefore, the care plan should include how the father is going to be helped to maintain his continence. Because the federal rules require that no one should lose continence, their ability to go to the bathroom, either bowel continence or bladder continence, unless it is unavoidable due to a medical condition. Not unavoidable because the facility just doesn't want to hire more staff. That's not acceptable. So we have a lot of tools here. This is one of the more basic ones, and I think one of the more helpful ones for people. But this is really valuable in supporting your care. And if you're seeing that there is something going on, it's good to come back to, okay, I want a care plan meeting. And maybe I also want another assessment because things have changed for my resident. So I want to talk a little bit about going beyond the facility. We have on our website, I posted a picture of you on the left-hand side, where you can report abuse, neglect, and even crime against nursing home residents. There are strong rules that prohibit abuse, neglect, and crime. And crime is a very comprehensive category. It includes a lot of different things, which we have defined here. But we have links here to federal context. We have links here to the state health department context, to the Medicaid fraud control unit, usually part of the Attorney General's office, et cetera. So what I note here on the right are the options that are available to you. File complaints. This is generally what people do as the first thing is they file a complaint with their state health department and or what's called the Medicaid fraud control unit. Every state now has a Medicaid fraud control unit. If you look up MFCU or Medicaid fraud control unit and your state name, you should come up with a link to that and you can file a complaint there. And again, you can go to our website and you can get the links to each of the state's Medicaid fraud control units there. The Medicaid fraud control units, MFUCUs as we call them, they are charged with addressing resident abuse and neglect. And so they can be very helpful. However, they do not have the regulatory authority, the kind of regular oversight in a nursing home that a state health department has. So you can file a complaint with one, or you can file a complaint with both, and a complaint can be made anonymously. Important as I note here, a complaint can be made in any form you like. That is based upon, or the statement, excuse me, is based upon the federal rules. The state can't say you have to do it through this form or we're going to reject it. You could put in a complaint verbally, or by phone, or you could put it in writing, which I would recommend. And of course, if you have it, you can include copies of what you've tracked, et cetera. We also recommend contacting your state or federal representative in Congress or in the state legislature. They can be a really strong voice. If you're not getting anywhere with the state, if the state is not responsive, if they return your complaint and say it's unsubstantiated and it's still a significant concern for you, contact what's called your CMS location. It's the federal agency that oversees the state. And again, we have contact information there. And then you might need legal help. You might say you want to sue the nursing home. We recommend using an attorney or firm that has many years of experience with abuse and neglect cases, particularly in nursing homes and or assisted living, because these are really very particular environments, and it's good to have someone with experience. And I think that's the end of my slideshow. So thank you very much, and I'm happy to take some time to answer questions, comments, etc.
Jeremy, since you're on, Jeremy entered a question in the chat. Do you want to ask your question live?
Yes, sure. Okay, so I just wanted to clarify when you're talking about the official grievances and that so a grievance does not need to be, am I right? I'm confirming here. Am I right that a grievance does not need to be designated as an official grievance and go through the whole, that sort of has that whole process and with the grievance officer, but any question or complaint that's conveyed verbally or via email is covered under the same grievance like regulations? Is that accurate to say? So if you just email to say, hey, they're not putting the call light near my mom, can you please look into this, and you don't get a response within a week, that's actually sort of not being in compliance with that regulation. Is that accurate?
No. So thank you. I'm sorry that wasn't clear. So people often do, file very, very casually a complaint or a concern. It's not really even filing. I would say they iterate that there's a concern. Maybe, it could range from the room being too warm or too cold to, not having, as you mentioned, the call bell in reach for the resident. Or it could be, that your resident has a pressure sore and you want someone to look at this, ASAP. Though that's a, making a casual, complaint or iterating a concern to the facility. A grievance is its own thing. So filing a grievance with the facility, that then triggers all the things that you can go to the grievance officer and filing a grievance, and then it's up to the officer to investigate what is going on and to get back to. So those are two separate things. And the grievance provides you, you should say, formally, I want to file a grievance about that, if you want that to be the case.
But how would you then, what sort of cover, how do the regulations cover though? In other words, when you're just not making it an official grievance, but obviously there's an expectation that they respond to you and address it. Is that not covered under the regulations? Then I was sort of thinking it was, but maybe that's not the case.
Yeah, no. Yeah, it absolutely is. It's so, as I mentioned at the start, the residents have, a lot of different rights, and those rights are all really based upon they have the right to live with dignity. They have the right to receive the care and services that they need. Well, the way it's put is to attain and maintain their highest practicable well-being, both clinical, physical, psychosocial. So if you have a complaint that's not happening, that is a violation of those standards. And you can iterate that complaint and expect a response to that complaint anywhere along the line, whether it be with a nurse aide who's on the floor, whether it be with the nurse at the station, director of nursing, someone on the administrative staff, medical director, or a complaint calling it into the state Medicaid Fraud Control Unit or the state agency. The grievance policy, the grievance rules really go to addressing that. Far too often those complaints don't go anywhere. Far too often residents and their families are not heard in their facility. So this provided a more essentially an easier way for families to try to address an issue, because the onus is not on them to, okay, I'm going to find a social worker, I'm going to try to get a phone call returned from the administrative office, etc. You are handing it to the grievance office. So it's really it's kind of separate and in addition, but you always have the right to have appropriate care and living conditions and to have your concerns addressed. That's just something extra and in addition. Okay. Does that make sense?
I think so. I'm just trying to figure out what regulation would it not fall under the same thing that you would expect a reasonable response? Is there any difference really between the getting a reasonable response within, whatever, and then it being addressed if it's an official grievance versus if you're just kind of call their attention to something, it seems like it would be the same thing other than you just designating it as an official grievance. So I don't want to.
I think that's a good way of putting it. But you would, and the benefit of designating it as an official grievance is that, one, you don't have to do as much legwork because it's up to the grievance officer to do that. But two is that the facility has to respond to you, and they have to, and yes, they do have to respond to you if you do a less formal or an informal grievance or complaint. But again, the reason why that grievance policy exists is because too often that just doesn't happen. I mean, what we're seeing now, and this has been unfortunately really prevalent, especially since the COVID pandemic, is facilities openly flouting basic resident standards every single day. It's frankly shocking to me, and I've been doing this for over 20 years. What I hear, frequently, what's going on. So the grievance policy is really just a strengthening, not of what your rights are, and not of your right to a response, but the strengthening of your ability to hold the providers accountable if they try to slough you off, which is unfortunately what happens too often.
Got it. Okay, thank you.
Sure, thank you. It's a good question.
Thank you for that question, Jeremy. We do have some questions from people, from registrants when they registered, that I'd like to ask you, Richard. One of them is, the staff do not return my calls. It takes several calls, among other issues that this family member is having. So what do we do when staff do not return calls?
Yeah, I mean, that is unfortunately a really persistent problem. And I also hear from a lot of people that no one picks up, and sometimes you can't even leave a message. So that's obviously pretty terrible and pretty frustrating. So again, I mean, I think all the kind of escalation that we talk about gets in there. If you're not getting, if you're calling the floor and the floor is not responsive to you, or you're calling social work or activities, you have a concern about your loved one's activities, and they're not responding to you, then I think that is really, time to escalate it. Talk to an ombudsman. That's always, I think that's a good start. Talk to your family council, raise it with your family council, because if other people are experiencing those issues, that makes the complaint, raising the concern that much more powerful. And again, you could file a grievance about that as well. And this is a good example. We have a fact sheets on actually pretty new fact sheets we just put out this week on the right to activities and activities that are appropriate for the resident, including residents who have dementia. Residents with dementia shouldn't just be wheeled into a room with a cowboy movie on and left there for the day. That's not an appropriate activity for a resident with dementia. So if you say you have complaints you have concerns about that, and the activity staff are not responding, then you can escalate in all the ways that we spoke about. And that's a great thing. I've heard family councils talk about, well, what are the activities? What activities are going on? Let's make some suggestions. Again, trying to be positive, but also, if necessary, holding the facility's feet to the fire. This is not an appropriate activity for residents, or you don't have appropriate activities for residents with dementia. And the activities, the rules, say what the activities have to be. They have to be tailored and appropriate to the needs and the interests of each of the residents.
Thank you for that, Richard. And Danny Spiegel asks, does this also apply to when not getting a response to your emails? Does that also to your calls? Does that also apply to emails, to getting emails returned or responses returned? Are there any regulations that apply to a lack of response via calls or emails?
I mean, I would say not specifically, other than that the facility has to be responsive to concerns raised, period. And they have to address them. And residents, as I mentioned, residents have the rights, or residents' rights, I should say, are in place 24 hours a day, 7 days a week, 365 days of the year. I don't care if it's a weekend. I don't care if it's July 4th or Christmas Day, etc. The facility has a responsibility for ensuring, that they have the appropriate staff with the appropriate competencies to take care of their residents. It doesn't, it's not a warehouse, or it doesn't suddenly become a warehouse on a weekend or a holiday because the facility, people are calling out. This is not the first Christmas for 99.99% of facilities. They should know what to do, and they should know what staffing they need. Just as that example. So there's nothing per se. There's nothing written that you have to get back in 48 hours or 24 hours, etc. But again, based upon the severity of the issue, you have a right to a response, and to a response that is going to address your concerns.
Does that satisfy your question, Danny?
Yes, well, you're saying there's a right, but is there any sort of teeth to it though? Like if they don't respond, like let's say you don't file a grievance. So in other words, there isn't like a ticking clock on this for whatever it is, 5 days, and you put in a response and they don't reply to it, and like a week goes by, and then 2 weeks go by and they don't actually respond to it. Is there anything within resident rights that you could say, hey, this is violating these resident rights and you owe me a response, without having to take it to a grievance level?
No. I mean, the short answer I would say is no. I mean, but I think it's important to really come back to the residents' rights are always there. So if those rights are being violated, that's what's unacceptable. So like family members really don't have any rights, to be honest. The rights all go to the resident. And so it's a resident's right to be, for instance, free of restraints. It's a resident's right to not have pressure ulcers. It's a resident's right to have an environment that is safe from falls, et cetera, especially if there falls risk, which, then that is particularly important. So it's not that the right is, okay, I have a right to a response in 3 days, and if not, then that automatically escalates. It's unfortunately not. It's that, is a persistence of a violation of the residents' basic rights affecting their well-being. That is the problem. And that's, again, I don't, I know, as Janine knows very well, the grievance rules and policies are not a panacea for everything, but they strengthen our ability. I mean, the reason why we're here is because there's so many persistent problems. And again, that's not excusable. But I just want to, it really comes back to, okay, it comes back to the violation of the care or the quality of life or the dignity standard. There's no responsiveness per se, except when it comes to a grievance.
Thank you, Richard, and thanks, Danny
Sure.
and Jeremy Spiegel, for asking really good questions.
Yeah, it's really interesting.
Yeah, they just started a family council in their mom's residence, and they seem to
Great.
having some success using many of our resources. And to that
and roadblocks.
of course,
Yes.
but you know what? It's going to be that way.
Yes, I know.
And you are not turning the cheek, but you are keeping your chin up, and you are engaging your fellow family members, and the residents will win as a result of your endeavor. So your return on investment is great. Thank you for doing that. Thank you for your advocacy. We received a question in the Q&A from Marcia Galloway. She asked, how do you start a family council if there isn't one already? Marcia, that is one of our favorite questions. And the answer is, you start one. Marcia, you can do it. If I can do it, and Jeremy and Danny can do it, you can do it. It is not as hard as you think. And there are more family members at your loved one's residence who need help and are probably thinking the same thing too. So you would just be the catalyst for it. If you need help starting a family council, I'm happy to help you with that. Our guidance and resources are free. I'll put my contact information in the chat, and I would love to talk to you about it, because it is, as I used before, the return on investment is great. Everyone wins with a family council. Every resident, whether you have a loved one in your life advocating for you or not, everyone wins. It is a wonderful, wonderful thing. And moreover, you will meet people and make friends that will last you for years as a result of your endeavors and your advocacy. So it is a wonderful thing to start. You'll learn a lot. And the staff, maybe not the administrators, but the staff will love you for it. They know that you are advocating for the people that they tend to care for and they care about as well.
Ginny, if I could just add one thing,
Yeah.
just very basic. When, as I said early on, we did trainings, for family councils several years ago when we with two family councils in the city, which started off our work and our fact sheets. And the way we were able to get funding from a foundation for that is because there were studies that showed, that nursing homes that had an active family council, the care was better for residents, not just residents of the loved ones in the family council, but for all residents. That care got better. So you really do make a difference. As we're all, talking, we know it can be frustrating. It'd be frustrating to deal with a nursing home, and it can feel very challenging. But you really do make a difference, and in particular for a family council. So it's really powerful and important.
Thank you for that, Richard. And it is powerful entity. It's a federally and state regulated entity. And more people are joining together to form family councils. Marcia, I'm going to put that information in the chat.
Okay, thank you.
You're welcome. You're welcome. And Haley also puts a link in there for you to look at as well. Does anyone live have any other questions about family counselor or about what Richard and I have been talking about today about having to escalate to get the care that your loved one needs?
If no one else does, I have another question that maybe might be helpful. So
Go for it.
So for our family council, we already submitted our first requests and the responses back were incomplete, to put it mildly. And so in the federal law, it says that a rationale, as I think you mentioned earlier, has to be provided, but they're not doing that. So if they actually do not provide a rationale, do either one of you have an advice as to how best to do that beyond saying, hey, you haven't provided a rationale?
So I'm sorry, I did you say you filed a grievance or it was
not a grievance. We had our first family council meeting. From the family council, we sent, here are the 3 issues we would like to have addressed. And for 2 of them, they didn't really respond to them and they didn't really provide a rationale for it. Like one of the issues was like during the dreaded change of shift, it's hard to get help for people like about a half hour before, half hour afterward, which really, when you add it all up, it's like 3 hours a day where it's difficult for residents to get help. So we said, is there anything that can be done to, sort of troubleshoot the situation to at least improve times? And they just basically wrote back, yes, that's because of people are getting reports and blah, blah, blah. If there's ever a problem, let us know. And it's like, yes, I know all that. That's why I'm asking. I'm actually asking you to try to make it better because it's clearly not 100% successful. So they're not actually providing a rationale. And I want to go back and say, hey, what can be done here? You're not actually providing it. Do either one of you have any advice in terms of like when even the answer is kind of, slippery?
Yeah. I mean, here I would say it is, well, I would respond that, well, it is a problem. You're having missed, your residents are having missed care for that time period. And is there a better way in which, or what can the facility do to ensure that residents get the services that they deserve during those time periods? Because those services are necessary. And that's the kind of thing that if you're working with an ombudsman, that could be that could potentially be helpful. If you are if it's not, you can consider filing a grievance, or you can consider filing a complaint that there is a pattern of missed care.
And is there any family council rules in terms of like, because once again, the law actually says they have to provide a rationale. So if they don't do that, can you in theory, cite them for it?
Well, it's the grievance, they have to provide a rationale. If they don't, if
For
they're not
family
going to,
council, it
right.
does too.
I think you're right. Sorry about that. Yeah, I think you're right. So, well, then you could ask them, just as you just said. Can you please? But it's more, to me, it's not so much the rationale is going to be for them. I would say is going to be, this is when we have the changeover of staff, and so that's how things are. I'm just guessing. I would say I can't speak for them, but that's not acceptable. If your residents are having missed care, then that is the problem, and that is something that they need to address. So I would say maybe pivoting a little bit on that question.
Okay, cool. Thank you.
Yeah, sure.
Anyone online on now trying to start a family council, thinking of one, it's as easy as just starting one. You being the person, you won't always have to be the leader, but you won't find any other leaders or any other people if you don't start it. And it's a lot easier than you think, and everyone wins, as I had mentioned before. Call us, email us, look at our resources online. You can do this. There is a flurry of activity in family councils in the last year, which is wonderful because that means that residents are being heard. It's something that you can build also with your ombudsman. The ombudsman that covers your home knows a lot about family councils, and they can help to support you and guide you. You won't be doing this alone. What we found over the years is when you approach an administrator or staff member as a single solitary family member, it doesn't carry as much weight as a group of you asking the same question. It just is a more powerful force, that unified family council. What else can I ask? And you don't have to have a hierarchy. You don't have to have a president, a vice president, a secretary, a treasurer. It's something that you can just have. It doesn't have to be loosey-goosey, of course, but if you can have a steering committee and write bylaws, come up with a mission statement, something just simple, and that will steer you and guide you through your work and your advocacy. And sign all of your correspondence. I tried to, just to begin with, sign it as on behalf of the family council. So that way it's not just coming from you. And that carries a lot of weight.
So do you start with the ombudsman? Is that who you go to first?
I would, yeah, because the
Okay.
ombudsman has probably met other family members like you who either have leadership qualities or frankly, they've asked if there's a family council, and she can have you all meet each other. And we provide a free Zoom room, the LTCCC does, that you can use as a safe, neutral space to Zoom in. Doesn't matter how many times you want to use it, how often you want to use it. My own family council, we contacted Richard in August of 2020, and he gave us permission to use his free Zoom room. We've been using it for the last 4 years. It's almost 4 years we've been using it. And they're very gracious about it. And it is, as I said, a safe, neutral space. No one can say anything. It is, encrypted. And it's a wonderful way for people to just be able to have the freedom to express themselves without having the fear of having a staff member or an administrator overhear what their complaints are. Jeremy, I have another question if there are no others. Jeremy, what is your question?
By the way, I'll just quickly say, and this is obviously it varies from ombudsman to ombudsman, but the ombudsman that covers our area is not at all helpful and doesn't know the regulations. And so just be prepared for that. And we got much more information from your organization. Janine and Gloria were much more helpful. So FYI, doesn't mean it just depends on the ombudsman. Okay. So my question is, you had mentioned something about that you can report it to the state, which is DPH, and then the CMS thing. I'll be honest, as my old boss used to say, I went to Hawaii for a moment and then, but now I'm back when you were saying that. And I'm a little confused as far as like, would you like say, to do like the CMS one? I'm a little confused about that, or does that vary by state? I guess I'm a little confused about that.
No, yes, thank you. It's a good question. So I tried to speed through that, but the hierarchy is that the state directly oversees nursing homes, and it's their responsibility for doing quality assurance. And that's the state agency, which is the Department of Public Health, or the State Department of Health is usually what it's called. And they are actually paid to do that by the federal government, the Centers for Medicare and Medicaid Services, CMS. So CMS oversees them. And if they're not responsive, then you can go to what we call CMS regional office. So there are 10 regions in the country. The country is divided up by 10 regions, and CMS has an office in each region that oversees the state in those regions. There's one for New England, there's one for New York, New Jersey, Puerto Rico, and the Virgin Islands. There's one for the states south of us, east of us, et cetera. So, and we have that contact information on that page. So you can find out where your regional office is. And if you're not getting a response, you can go to them. Look, I'm not getting it, or my complaint came back as unsubstantiated, is what they say. They said, you know, and that often is a big issue.
Okay, so basically, but you would still you have to kind of do the DPH one first, because then it's like an appeal process almost, basically. Okay.
Yes, yeah, essentially. And I would say, you know, it's along the same lines as the DPH is the Medicaid Fraud Control Unit. And generally, they're supposed to be sharing complaints. I personally feel that because the states tend to be the state agencies, the state departments of health tend to be pretty weak when it comes to oversight, that I tend to favor the Medicaid Fraud Control Units, because I think that they are stronger in terms of resident protections and in terms of triaging problems that come in. However, and sorry to get into the weeds a little bit, they don't have regulatory authority. So they're not going into every facility. They're not responsible for the 24/7, 365 the way the state agencies are. However, if you go to both, or if you start with the Fuku and they report to the state, I always feel like that gives it a boost in terms of legitimacy, because the states tend to be dismissive of residents and family. Does that make sense?
Yes, I was concerned. I listened to the podcast and I was concerned about that. So I'm sorry, just to be clear. So there's three things here. There's the oversee regional thing, and then you're saying that there's the DPH, which has the teeth, and then I'm sorry, the Medicaid
Fraud Control Unit, Medicaid Fraud Control Unit.
So would you submit both to, and I'll get information?
Yeah, I mean, I always worry about giving people too much to do, you know, frankly, and that's why I emphasize
anyway. What's different, right?
I mean, exactly. Okay. Yeah. So I would, if it was me, I would file it with both. I would file it both with the state and with the state agency, the state DPH or health department, and I would file it with the Medicaid Fraud Control Unit. So, and they do have teeth. They both have teeth, but the state agency, the health department can do a regular fine. They come in, et cetera. They are responsible for all homes in the state. The Medicaid Fraud Control Unit tends to do more selective investigations where there's a strong case. So when there is a strong case, they can have really strong teeth. I mean, like in New York State, which has led, the Fuku here has really led the country in this way. The Attorney General has gone after facilities for millions of dollars and gotten what is it called? Corporate integrity agreements, meaning that there's monitors that come into the facility to make sure they're doing what they're supposed to. Some other states have started to do that. Are you in Massachusetts? Massachusetts has started to do that a bit. And New Jersey has done that a little bit. But for the most part, it's really ongoing. And again, New York has really kind of been a lead here in terms of those kind of activities. So it can be strong, it can be very meaningful, but in terms of of the general oversight, that's generally, that's typically done by the state, or that's more done by the state Department of Health or Department of Public Health.
Okay, and really quick, do you tell them, hey, I'm also like cross filing with, you know?
I don't think I wouldn't necessarily. I don't know if it makes a difference. You could if you want to, but I mean, I wouldn't give either I probably wouldn't. I
Okay.
probably would just see what happens.
No, that's
It's
fine.
a good
Makes sense.
question, though. I hadn't thought about it. But it's a good question. But you're probably more likely to get someone to think, oh, this is something we need to take action on if they know
Right.
that you're the one, if they think you're the ones that they complain to. Solely.
Right. Otherwise, if you do both, oh, they'll take care of it. I don't have to worry about it.
Exactly. Yes,
Yeah.
you don't want to have that.
Okay, thank you so much.
That's a great question. Thank you, Jeremy.
Thank you. Thank you, Jeremy and Danny Spiegel. Thank you to everyone who asked questions today. And thank you for everyone who submitted questions and
Yeah.
signed up, registered and showed up. You will be receiving a recording of today's episode in a few days after we clean it up and make it all shiny and get rid of all my wrinkles. So thank you so much for that. Continue to use our resources. The Long-Term Care Community Coalition is there for families and residents. And as Richard mentioned, it's the residents who have all the rights. So as long as we keep everything resident-centered, the residents and then we win. So stay tuned, sign up for our newsletters, sign up for our webinars. You will not lose. The return on investment is huge. Everyone wins.